A violent hospital attack caught on camera. A patient at Ridges Hospital in Burnsville ran into the hall with a bed rail, swinging it at people. That was just the beginning. In all, 4 people were hurt in the February attack. Only 1 has returned full-time to work. Tonight, one man is sharing his story with WCCO senior investigative reporter Jennifer Mayerle, who found attacks like this are happening more often than they used to.
Watch the top center of the screen as the patient on a mental health hold strikes hospital support staff, then takes a swing with the bed rail at EMT Rob Madsen, who was waiting to transport a patient.
What do you remember from that moment?
It was a bang, and I knew I was hit hard. He hit hard in the back of my head, and I was on the ground, and then I just saw all the blood running and just pooling right around.
Here's another angle of the attack. It all happened in under 10 seconds. This camera captures staff realizing what was going on, frantic to stop the patient and to help.
The nursing was yelling that they had a medic down, which was me. There was another co-worker. He was on the ground and unresponsive. They came out and gave me some gauze bandages to hold on the back of my head. And then they put me on a stretcher and got me out of there.
Madsen underwent brain surgery and ended up with 25 staples in his head. He says the pain remained weeks later.
Just with the flashbacks from it, the headaches are incredible. Nausea, vomiting, coordination, short memory loss.
In all, 4 people were injured. 2 were nurses.
Workplace violence is really common.
Nurse advocate Benjamin Baker with the Minnesota Nurses Association, or MNA, says it's everything from verbal abuse to spitting on staff to physical attacks.
It's everybody. It's nursing assistants, the paramedics bringing patients in the ambulance are at risk. I know doctors that have been injured. It's not just nurses, but it's nurses at a higher rate.
Year over year, data from DLI shows nurses had the most workers' comp claims paid with injuries from violence or another person. A recent MNA survey found 86% of nurses who left in 2024 reported inadequate staffing was an issue.
I feel like there's, I'd call it correlation, but it's probably causation between the number of staff that you have on a unit, specifically nurses, and the ability for those nurses to de-escalate and prevent from violence occurring. And so as hospitals decrease nursing staff, it is correlated, I think, to violence increasing.
MDH reports the number of physical assaults against patients or staff that resulted in serious injury climbed over the past decade, going from 1 to 16.
Looked around and saw the tech on the floor unconscious, and then, I started bleeding.
For Madsen, his attack reignites the conversation surrounding hospital safety.
I didn't feel there was any precautions. This patient was moving around about within the unit and had access to me and other patients.
The attack happened in a locked 8-bed behavioral health unit designed to reduce risk, where the hospital said it made intentional investments in safety. It updated its policy following the attack, including ensuring all patients are in their rooms during a patient transfer.
My point is to make the point and advise other healthcare facilities and personnel is that you have to be aware of your surroundings. Be diligent and stand up and have policies in place. It's for the safety.
Jennifer Mayerle, WCCO Investigates.
The patient who attacked Madsen died while in the custody of the Dakota County Sheriff's Office. In a statement, they extended their condolences to the family and said the medical examiner found the cause of death to be natural. In the past few years, the legislature has created change. All hospitals must now submit a violence preparedness plan. MNA says it supports legislation that would put minimum nurse-to-patient ratios into state law. You can read Fairview's full statement on the incident at WCCO.com.